Imagine this for a moment. Every morning, you crack an egg, the shell breaks, and something far more complex than breakfast quietly enters your bloodstream. As a urologist, when I look at that simple act, I don't just see protein or calories, I see kidneys filtering, hormones signaling, cells repairing, and a delicate balance between nourishment and overload. Eggs are one of those foods that sit at the intersection of nutrition and physiology. And what happens when you eat them daily is not dramatic, but deeply instructive about how the human body works. When we talk about protein and the kidneys, fear often enters the conversation before physiology does. Yet the healthy kidney is one of the most adaptable organs in the human body. Eating eggs daily introduces complete protein made of essential amino acids. And when these amino acids are absorbed, the body uses what it needs for tissue repair, enzymes, immune signaling, and muscle maintenance, while the remainder is metabolized into nitrogen-based waste. This is where the kidney steps in, not as a fragile filter under threat, but as a finely tuned regulator designed for this exact task. In a healthy individual, the glomeruli adjust filtration rates smoothly, increasing efficiency without strain, clearing waste, while preserving vital electrolytes and fluids. This process is not a stress response. It is normal physiology in action. What is often misunderstood is the difference between workload and damage. The kidneys are meant to work. Just as muscles strengthen through use, renal filtration adapts to dietary patterns without injury when the tissue is healthy. Eggs provide protein that is highly bioavailable, meaning the body wastes less of it compared to low-quality sources. Less waste means less unnecessary metabolic byproduct, which paradoxically makes eggs gentler on the kidneys than many processed protein foods. The efficiency of egg protein allows the kidneys to perform their role with precision rather than excess effort, maintaining balance rather than fighting imbalance. Problems arise not from eggs themselves, but from context. In individuals with chronic kidney disease, filtration capacity is already reduced, and protein intake must be tailored carefully. This is not because protein is toxic, but because the kidneys no longer have the reserve they once did. In this setting, eggs become a tool to be used thoughtfully, not a danger to be avoided blindly. One egg may provide valuable nutrition without overwhelming the system, highlighting that the issue is organ capacity, not the inherent nature of the food. Daily egg consumption also supports lean muscle mass, which indirectly protects kidney health over time. Muscle tissue helps regulate glucose metabolism and insulin sensitivity, reducing the risk of diabetes, one of the leading causes of kidney failure worldwide. By stabilizing blood sugar and reducing metabolic stress, eggs participate in a protective loop that preserves renal function rather than eroding it. This is a long-term effect, quiet and gradual, but deeply relevant in clinical medicine. From a urologist's perspective, eggs reveal a deeper truth about human biology. The body is not as delicate as modern fear suggests, but it is sensitive to imbalance and misinformation. When kidneys are healthy, they do not panic at protein. They respond with intelligence and adaptability, filtering, conserving, and recalibrating moment by moment, turning a simple daily egg into an example of biological trust. From a urological perspective, urinary chemistry is less about individual foods causing sudden problems and more about patterns that quietly shape the internal environment over time. Eggs are often misunderstood in this context, especially when people worry about kidney stones, uric acid, or bladder irritation. In reality, eggs are naturally low in purines, the compounds that break down into uric acid. This matters because elevated uric acid can crystallize in urine, contributing to gout and certain types of kidney stones. When someone eats eggs daily, they are not significantly increasing this risk, and in many cases, they are doing the opposite by choosing a protein source that does not overload this pathway. Urine composition is influenced by what the body must discard after metabolism. Foods high in purines, excessive sugars, or certain additives force the kidneys to excrete larger amounts of irritants, altering urine concentration and pH. Eggs, by contrast, are metabolically clean. Their amino acids are efficiently used for repair and maintenance, leaving behind relatively little waste. This efficiency results in steadier urine chemistry, with fewer sharp fluctuations that promote crystal formation. The kidneys and bladder respond well to this kind of metabolic calm, where filtration is predictable rather than reactive. Another important factor is urine acidity. Extreme shifts in urine pH can encourage stone formation and irritate the urinary tract. Eggs are largely neutral in their effect, meaning they do not push the urine strongly toward acidic or alkaline extremes. This neutrality supports a stable urinary environment, which is especially valuable for individuals with a history of calcium oxalate stones. Stability, more than any single nutrient, is what the urinary system favors. It is sudden spikes and imbalances that create conditions for stones to grow, not quiet consistency. There is also an indirect benefit that often goes unnoticed. People who eat eggs regularly tend to rely less on ultra-processed breakfast foods high in sodium, refined carbohydrates, and artificial additives. Excess sodium increases calcium excretion in urine, raising stone risk, while refined sugars can disrupt insulin signaling and fluid balance. By replacing these foods with eggs, many individuals unintentionally reduce urinary stressors. The egg itself is not acting as medicine. It is simply removing harmful variables from the equation. Hydration behavior also plays a role. Protein-rich whole foods, like eggs, tend to promote satiety and more mindful eating patterns, which often correlate with better hydration habits throughout the day. Adequate fluid intake dilutes urine, lowering the concentration of minerals that can crystallize. In clinical practice, this dilution is one of the most effective defenses against stone formation, and eggs fit naturally into routines that support it. Seen through the lens of urology, daily egg consumption does not provoke the urinary system. It cooperates with it. The kidneys filter calmly, the bladder stores without irritation, and urine chemistry remains balanced, illustrating how simple, unprocessed foods can support internal harmony without dramatic intervention or fear-driven restriction. When the conversation turns to cholesterol, especially in relation to eggs, it often becomes emotionally charged. Yet from a biological standpoint, cholesterol is not an enemy but a raw material. Every cell membrane in the human body depends on it, and in urology, its role in hormone production is particularly important. Testosterone, estrogen, and other steroid hormones are synthesized from cholesterol through carefully regulated pathways. When someone eats eggs daily, they provide the body with a natural source of this building block, allowing hormone production to proceed smoothly without forcing the liver to overcompensate or rely entirely on internal synthesis. In men, testosterone influences far more than muscle or libido. It plays a role in prostate tissue regulation, red blood cell production, mood stability, and even urinary tract muscle tone. When dietary cholesterol is severely restricted, the body can still produce hormones, but it may do so less efficiently, especially under stress or aging conditions. Eggs offer cholesterol in a biologically familiar form, packaged with fats and nutrients that the body recognizes and integrates rather than treats as foreign. This is why moderate egg consumption does not disrupt hormonal balance in healthy individuals, but supports it. There is also a misconception that cholesterol from eggs directly translates into harmful blood cholesterol. In reality, the liver dynamically adjusts its own cholesterol production based on dietary intake. When eggs provide cholesterol, endogenous synthesis often decreases, maintaining equilibrium. For many people, this results in little to no negative change in blood lipid profiles, and in some cases, improved HDL levels, which are associated with healthier blood vessels. From a urological perspective, this matters because blood flow is central to erectile function and pelvic organ health. Hormones and circulation are inseparable partners in this system. Prostate health adds another layer of nuance. Hormones guide cellular growth, repair, and inflammation within the prostate. Balanced testosterone levels support normal tissue turnover, while extremes in either direction can create dysfunction. Eggs contribute not by forcing hormone spikes, but by supplying the materials needed for steady regulation. Alongside cholesterol, eggs contain fat-soluble vitamins and micronutrients that participate in anti-inflammatory processes, helping the prostate environment remain stable rather than reactive. As men age, hormonal efficiency naturally declines, not abruptly but subtly, year by year. In this phase of life, nutrition becomes less about restriction and more about support. Eggs, consumed daily in reasonable amounts, act as nutritional scaffolding, giving the endocrine system what it needs to adapt gracefully rather than struggle. This does not mean eggs are a hormonal cure, but they are part of a dietary pattern that respects the body's design. From the urologist's viewpoint, eggs remind us that health is often maintained through sufficiency rather than avoidance. Hormones are not driven by single foods, but by the availability of essential components delivered consistently over time. When cholesterol is supplied in a natural, moderate way, the body responds with balance, not excess, allowing hormonal systems to function with quiet reliability rather than compensatory strain. Inflammation is often spoken about as if it were a single event, but in the body it behaves more like a background signal, rising or falling depending on daily inputs. From a urological standpoint, chronic low-grade inflammation is one of the most common invisible forces behind problems with blood flow, nerve signaling, and tissue sensitivity in the pelvic organs. Eggs enter this picture quietly, not as an anti-inflammatory drug, but as a food that supplies the raw materials. Cells need to maintain structural integrity and resist unnecessary inflammatory signaling. When someone eats eggs daily, they are providing nutrients that support cellular calm rather than cellular alarm. One of the most important of these nutrients is choline, a compound essential for building and maintaining cell membranes. Every nerve cell, including those responsible for bladder control and erectile response, relies on stable membranes to transmit signals accurately. When membranes are weak or damaged by oxidative stress, inflammation rises as the body attempts repair. Choline helps reinforce these membranes, reducing the need for inflammatory responses. Over time, this contributes to smoother nerve communication, which translates clinically into better urinary coordination and more reliable vascular responses. Eggs also contain antioxidants that counter oxidative stress, a major trigger of inflammation. Oxidative stress damages blood vessels, making them stiff and less responsive. In urology, this directly affects erectile tissue, which depends on flexible, healthy blood vessels to fill and empty properly. When oxidative stress is reduced, blood flow improves not through stimulation, but through preservation of vessel health. This is a subtle distinction, but a critical one. The goal is not to force function, but to protect the structures that make function possible. Inflammation also plays a central role in benign prostate enlargement and pelvic discomfort. While eggs are not a treatment, their nutrient profile supports a metabolic environment that does not fuel inflammatory cascades. By providing high-quality protein without excessive additives, sugars, or oxidized fats, eggs reduce dietary triggers that would otherwise amplify inflammatory signals. The prostate, like many organs, responds poorly to chaos and well to consistency. Stable nutrition creates a calmer tissue environment. Urinary function is similarly influenced by inflammation. The bladder wall is sensitive to inflammatory mediators, which can increase urgency, frequency, and discomfort. Diets high in irritants often worsen these symptoms. Eggs, being gentle on the digestive and urinary systems, do not provoke these responses. Instead, they allow the bladder to operate without constant biochemical irritation. This effect is often unnoticed until it is absent, which is why patients are surprised when simple dietary changes improve symptoms. From a broader biological perspective, daily egg consumption supports inflammation control by reducing nutritional stress. When the body receives complete nutrition, it does not need to overactivate immune pathways to compensate for deficiency or imbalance. This is not about suppressing inflammation entirely, which would be harmful, but about allowing it to rise only when truly needed. In this way, eggs participate in a form of quiet prevention, supporting blood flow, nerve health, and urinary comfort through cellular stability, rather than dramatic intervention. One of the most overlooked aspects of human health is not what the body can tolerate in extremes, but what it quietly prefers when given a choice. From years of observing physiology and patient behavior, a consistent pattern emerges. The body thrives on predictability. Eating eggs daily illustrates this principle in a remarkably simple way. The organs involved in digestion, filtration, and hormone regulation do not need novelty to function well. They need reliable signals. When nutrition is consistent, the body expends less energy adapting and more energy maintaining balance, repair, and coordination. The kidneys, for example, respond favorably to steady nutritional input. When protein intake fluctuates wildly from day to day, filtration rates must constantly adjust, and waste processing becomes reactive rather than smooth. A daily egg provides a modest, predictable amount of high-quality protein that allows renal processes to settle into a rhythm. This rhythm supports efficiency, not through reduced work, but through reduced uncertainty. In biology, uncertainty is often more stressful than workload itself. Digestive signaling follows a similar logic. When the stomach and intestines recognize familiar foods, enzyme release, bile flow, and absorption pathways become streamlined. Eggs are digested efficiently, leaving little residue or irritation. Over time, this predictability supports gut integrity, which indirectly influences urological health through immune regulation and inflammation control. A calm digestive system sends fewer distress signals to the rest of the body, allowing other organs to function without interference. There is also a behavioral dimension that cannot be ignored. Consistent, simple foods reduce decision fatigue and impulsive eating. When people rely on eggs as a nutritional anchor, they are less likely to reach for highly processed alternatives that disrupt blood sugar, increase sodium load, and introduce inflammatory compounds. This behavioral stability translates into metabolic stability, which benefits organs like the kidneys and bladder that are sensitive to systemic fluctuations. From a physiological perspective, consistency supports hormonal timing. Hormones are released in patterns, not in isolation. Regular intake of nutrient-dense foods allows these patterns to remain synchronized. Eggs provide fats, proteins, and micronutrients that fit naturally into these rhythms, supporting gradual hormone release rather than abrupt spikes. This steady signaling is essential for long-term tissue maintenance, including prostate and vascular health. On a deeper level, eating eggs daily reflects a broader philosophy of nourishment. The human body evolved in environments where food variety existed across seasons, but daily meals were often simple and repetitive. Our physiology is adapted to this pattern. When modern diets introduce constant novelty and extremes, the body must continually recalibrate. Eggs offer a return to simplicity, not as restriction, but as respect for biological design. Seen through this lens, daily egg consumption is less about the egg itself and more about the message it sends to the body. The message is one of reliability, sufficiency, and trust. When the body receives this message consistently, organs operate in harmony rather than competition, and health becomes a state of quiet cooperation rather than constant correction.